Today's topic what we are going to discuss is public health and the government. As a citizens of an independent nation like India, we feel that every person, every citizen of India should experience facilities of good health, good sanitation, good house, good food, everything. But in actual reality, whether all the Indians are able to acquire or utilize their facilities what we are expecting us. As per the Constitution of India, the citizens are entitled to get all these rights equally, and there should not be any discrimination based on caste, color, creed, rich, poor, or all these things. But what is happening in actual reality? Where does India stand in the public health and services provided by the government? How many hospitals do we have? Every year, how many doctors are getting upgraded or qualified? We will find out all these facts in this lesson, and we also will discuss what is the basic discrimination that is being felt in regarding to the medical fields. How is government trying to cope up with these things? What is the tough competition that is giving for the government services? What is the basic difference between them and us? What is the dividing marginal line between the government service sector and the other service sectors? We will finalize all these. After going through in these lessons, we can get into touch with the actual ground reality of the health condition in India. India being standing the number one position in providing and exporting of the medicines, but then what is the condition of the medical facilities that are going to be reached to the Indians? In order to ensure that no person falls ill, what are the basic requirements for us? We have to provide them good sufficient amount of nutritious food, good water facilities, and the sanitation facilities also should be very clean. And reading to the other aspects which are required is that in order to provide a better health facilities to the people of a nation, we need the health centers in order to give for them the primary advices whenever it is required for them. And at the same time, we need hospitals to approach whenever we are not feeling well. In order to get the best treatments, qualified doctors play a vital role in order to provide the valuable treatment for the people and get recovery for them very soon. And moving on to the laboratories, to test what kind of diseases are found in the blood samples, in the urine tests, or in order to analyze the situations, why a person has fallen ill, what has made him to become ill. All these answers you can get through the laboratories, and the lab technicians assist the doctors to get them the final output of the treatment so that the patient can be treated better. And moving on to the blood banks, the most important problem of the present generation is that we don't have the sufficient amount of blood banks in our nation. That is one of the major drawback for us, even though India hails to be the largest country in population. But if you want a blood group of a particular blood, you can't get it. You want a blood of a blood group called B positive, it's very rare. O positive, rare. But we have to find the people who are ready to willing to give them. Even though India has a large number of people, you don't find the people of willingness to donate blood for us. So these kind of problems should be overcome. But India has a sufficient amount of the blood banks as per the time requirements, and the government is planning in order to maintain the sufficient amount of the blood, and even we have the private banks also maintaining the blood as per the requirement. Let's hope nobody falls ill the lack of the blood. And moving on to the human resources aspect of things, who support the doctors are, the first one is in the primary health centers, we need the health workers who will be doing all the works. They will be visiting the villages, finding out the samples, water samples, collect the water samples and find out what is the diseases that are found in the water, or why the water is getting contaminated, what is the solution for that one, in order to rescue the people from any such kind of diseases which are going to affect them. And moving on to the nurses, we have nurses providing services who are very crucial for a patient. With them, with their care only, we come to know what is the actual process of serving somebody. So nurses do their services with wholeheartedly and serve the patients. And moving on to the doctors, The doctors are considered as the semi-gods because those people are the people who save us from the dangerous diseases. What we can't understand by our body, these people can understand it and try to solve it very easily and as per the medicine's requirement. Sometimes even some people feel that even if their hand kept on them also can heal us. So the people we have good doctors, automatically the society also will be cherished. And moving on to the lab technicians, we need qualified lab technicians in order to get the exact output of the problems of the machinery and to analyze the machine's results which are given by the various other kinds of scanners and all these things to get into the actual picture of what is happening in the body. Like this, we have the various roles of the institutes which have to play their part in order to ensure to have a healthy and prosperous nation as well as society. But it also means that we need to provide sufficient amount of food for them and good water facilities supplied to all the individuals of the nations and the citizens of the nations, which ultimately leads to a nation to be a healthy nation. Where does India stand in this kind of providing the facilities? Does India own to be the number one position in providing the best medical facilities? If yes, how? If no, why? India is the largest country where it stands fourth in the production of the medicines. Let us see now. India has operated the public service system or the public healthcare system in a very efficient manner. India holds to be one of the largest country not only in population but provides many facilities and build many number of hospitals to cater the services to the lakhs of people who stay in the villages. Let us see the figures of which are very impressive here. See, India stands fourth in the production of the medicines. India produces large number of and variety of medicines in the world and it's standing number 4 in the production of the medicine, which is just after the superpower nations. And moving on to the next, India has the highest number of medical colleges in the entire world. India wants to be more number of medical colleges in the world, and every year from India 15,000 doctors get qualified. This number itself, it shows that there is a high amount of doctors coming out in order to serve the people by their services. At the same time, if you see the statistics of the hospitals, in 1950 the hospitals were 2,717, while the number moved on in 1991 it was 11,174, and finally in 2000 it number went on to 18,218. Now if you have seen the picture of the Indian global health situation, the situation is that if you look at the statistics, it feels like the effective services have been done to the people and the citizens are getting the actual benefits of the public healthcare system. No, but the actual view of the constitution reveals that every Indian should be treated equally and ensured to get the best treatment in order to have the equal sustainable growth. But in actual terms, we have the actual picture contrary to the views of the constitution. Let us analyze this with an example. Let us see with some two characteristics having the same kind of diseases, what are the situations that have met them when they are approached to a private hospital and when they are approached to a government hospital, and what are the different systems of healthcare are existing in India. We shall analyze now. Let us see the example.